Facts about BPH. So this is benign prostatic hyperplasia. This is where you have just a big prostate. And so a big BPH is not associated with prostate cancer. So you can have a big prostate and not have prostate cancer. BPH may not be associated with urinary problems, or it may, depending if the middle part, where the urethra is, if that gets bigger and it kind of squeezes on the urethra. Okay. BPH may not be associated with any other problem. If the prostate, however, is really big, and I'm talking about, we said that normal is 20 grams, right? Size of a walnut. Let's just say the prostate is the size of an orange. Well, now, though it's not associated with prostate cancer and other life-threatening health issues, it will push up on the nerves that surrounds the prostate, that innervates the penis, and it can be contributory to erectile dysfunction, because now the nerves are being squeezed because the prostate is so big. So the only thing in a very, 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 very big prostate that BPH is associated with is erectile dysfunction. So the definition of BPH is hyperplasia. So it's an excess accumulation of prostate cells in the smooth muscles of stromal areas of the prostate, and in the transitional zone. The transitional zone is the area that surrounds the urethra. All right. So the IPSS is the questionnaire that most men are familiar with when they go to the urology office. Is the the prostate symptom questionnaire, and that's what's used. Men from Southeast Asia seem to have smaller prostates than men from Western countries. I don't know why that is. And honestly, I don't know that it really matters, again, for reasons that I've mentioned. And most people want to say, well, Asians are, they have lower risk of prostate cancer and smaller prostates because they eat more tofu, or because they have more of a vegetarian lifestyle or vegan lifestyle, or they also smoke a lot more than we do. So I don't think it's that simple to say that Asians have smaller prostates and lower risk of prostate cancer because of their diet or something, or because they smoke a whole lot more than we do. So it's hard to say. And BPH is associated with low androgens and high estrogen. So the notion that testosterone it's the cause of BPH is not true. High estrogen levels cause BPH. And if you noticed, you never seen a 25-year-old guy with big prostate. And a 25-year-old guy, male, right, has high testosterone, very low estrogen, right? As men get older, that ratio keeps changing. So now testosterone is decreased and estrogen is increased. So if testosterone was a problem for the prostate and even prostate cancer, then you would have 25-year-olds with prostate cancer and BPH. That's not the case. So estrogen, and I think that's another area that we're missing out on, because I don't see a lot of my colleagues looking at estrogen as a possible factor in an increase in BPH. So. All right, so normal, so on the left-hand side, we have a normal situation. We have a bladder, nice detrusor muscles, right? The detrusor muscle is the muscles of the bladder, nice and thick. Prostate opens when it's gonna urinate, right? And this causes a nice flow of urine. In a situation of BPH, if the prostate is too big and the transitional zone also, right? This is the area around the urethra. also squeezes in the urethra, then you causes several problems. It causes urinary retention, so you have a hard time peeing, and then it causes backflow of the urine into the bladder. Now the bladder is overworking to try to pee, which causes hypertrophy, right? So it causes the muscles of the bladder starts increasing in size, and it starts not working properly, right? So this is why any obstruction, urinary obstruction, whether it's related to BPH or any other causes, it needs to be treated. So once you start, my suggestion is you be mindful of your body when you go urinate. Look, your urination is going to weaken with age. That's not a problem. The problem is when it's significantly, when you hear just a dribble consistently. But here's a takeaway for you. It's okay to have just a very weak stream once in a while. Okay, once in a while is okay to have a little bit of a weak stream. The problem is when it's a weak stream all the time, consistently. For example, most men after a certain age, that morning pee is a little bit weaker. That could be normal. But if it's a weak stream in the afternoon, at night, throughout the day, then that's something to look into. So then you want to address that early, naturally, hopefully, but in some way, even medically. All right, so BPH symptoms cause a weaker stream, hesitancy, it's intermittency. So there's like stop and go, dribbling, incomplete emptying, dysuria, where there's a little bit of discomfort from urinating, and nocturia, which is nighttime urination. What causes an increase? So, Dr. Geo, my prostate is going to be a problem anyway as I get older. There's nothing I can do about it. I'm not sure. Is it nature or is it nurture? I don't know. But I do know that as men get older, they typically get more unhealthy and they start developing other types of problems like metabolic syndrome and hypertension and cholesterol and all these things. And all these things seem to contribute to all prostate problems, not only BPH, but certainly BPH. So men with lower urinary tract symptoms have higher, let's say, hemoglobin A1C. Hemoglobin A1C is that biomarker that you look at to see how your blood sugar is within the last 3 months, right? So hemoglobin A1C, but your urologist is not going to look at hemoglobin A1C. Because now we're talking about looking at things more holistically, and it's not how it works. Now, I'm not knocking urologists. Let me be clear here. They are very good in just focusing on helping you with your prostate problem, and through pharmaceuticals or surgical procedures, some of which actually are very helpful if you need it. But they're not going to look at hemoglobin A1C, C-reactive protein, all these other biomarkers that are absolutely essential to figure out what's going on with your prostate. Okay, so obesity, the heavier the person is, the higher the size of their prostate on average. The higher their waist to hip ratio. So guys with big bellies have a higher prostate, a bigger prostate. C-reactive protein, the higher that is a C-reactive protein, of course, is an inflammatory biomarker that you can get from blood tests. There's a higher probability of BPH, and sometimes there's bacteria and viral strains found in biopsy that are. So the idea here is, how do you create a microenvironment in your body that's hostile to all these bugs, including COVID, but these other bugs that are in your body, and how do you look at reduce inflammation and things like that keeps you stay fit, stay keep slim, how do you do that? And this is where, when we talk about lowering the risk of prostate problems, this is a major area. And again, nature or nurture? I don't know. I think it's mostly nurture. So who's at risk of BPH? People that are over 50. But again, 50 is not old. Okay, I'm not only saying that because I'll be 50 this year. I really mean that 50 is not old. This is completely objective. 50 is not old for a man. So I think it's a lifestyle problem, right? Why we age. So anyway, but studies show that 50, but yes, on average, in a general population, as men get older, they get older. As men get older, they start aging more, right? Metabolic syndrome, this is a scenario with us hypertension, high lipids, glucose problems, big waist, insulin resistance, right? So that is a problem for BPH. And prostate growth is 47% in men with type 2 diabetes, 17% in men with hypertension, and 36% in obese men, and so forth. So again, these things, you have to look at the body systemically. BPH, erectile dysfunction, these are systemic problems. This is not a local problem. This is a systemic problem. IPSS, we spoke about that earlier. Inflammation and BPH. So there is all these inflammatory biomarkers that we would look at. C-reactive protein actually covers quite a few of these.